the remaining 10 presenters for the afternoon now, and the first of those is Dr. Morgan Wallace. Morgan is from Federation University, and her presentation is titled The Importance of the Immune System in Chronic Lymphocytic Leukaemia. Lymphocytic, thank you. When you're ready.
Okay, so I thought I would start by introducing the immune system. What our research is really interested in is how the immune system might be involved in protecting individuals from cancer. So the immune system is made up of many different kinds of white blood cells. Some of them are shown at the top of this slide here. You don't need to remember the names of all of these different kinds of cells. What's important about them is that they all have different functions and they're able to work together and communicate with each other in order to do their job. The main job of the immune cells, of course, is to fight infection. So this cartoon here shows a white blood cell protecting the healthy cells of the body against invasion by this motley crew of viruses and bacteria over here. And the immune system does this very effectively. There's an increasing body of evidence that the immune system is also involved in fighting against cancer. When a normal healthy cell in the body undergoes malignant transformation and becomes a cancer cell, some of these immune cells, particularly the natural killer cells and lymphocytes over here, are able to detect the changes in the cell and kill those cells. These are the cells that our research is particularly focused on. The problem is that cancers have ways of escaping from the immune system. They can do this by producing substances that inhibit the function of these cells. They can also change in ways that allow them to hide from the immune system, so the immune cells can't see them anymore. And when this happens, cancers can grow. The particular type of cancer that my research is focused on is chronic lymphocytic leukemia, or CLL. CLL is the most common cancer affecting adults. It typically affects individuals from the ages of 40 through to 70 with a median onset age of 60. It's actually a cancer of a type of white blood cell known as a lymphocyte. So patients that have chronic lymphocytic leukemia show an increased number of lymphocytes accumulating in their blood over time. One of the unusual things about CLL compared to many other cancers is that patients can remain stable for very long periods of time. So what this graph on the slide shows is a normal healthy adult and a CLL patient, and we're looking at the number of lymphocytes in the blood over a number of years. In a normal healthy individual, the number of lymphocytes remains low and constant over time. In a patient with CLL, the number is elevated, but it remains stable before increasing rapidly. While patients are in this stable phase of the disease, they're actually well. They don't need any chemotherapy or treatment, and they're monitored regularly by taking blood samples to look for the increase of lymphocytes that would indicate disease progression. As the disease becomes progressive, the patients become ill, and this is where they require chemotherapy, and that has the associated side effects that we heard about earlier. Our research problem is what's happening in the immune system of these individuals as they move from the stable to progressive disease. Are there things that are changing about the immune system that are allowing the cancer to grow when the disease becomes progressive? Through our collaboration with clinicians at St John of God Hospital in Ballarat, we've been able to get access to a number of samples from the same patients over the course of their disease. And so our research process is to analyse the different kinds of white blood cells, remembering there's all these different types, see how many of each different immune cell type is present in the blood, and whether they're functioning normally. We have some very interesting results suggesting that lymphocytes, which is one of the populations we're interested in, are reduced in number in patients as they enter the progressive phase of the disease. We're now looking at whether the immune cells are functioning normally in these patients. Most importantly, we want to know whether the changes that we're seeing correlate with the stage of the disease that the patient's at. So whether changes are happening as patients move from the stable to the progressive phase of the disease. The research outcomes that we hope to achieve are first of all to identify changes that might predict disease progression. At the moment, there's no really good way of telling when a patient is going to move from stable to progressive disease, and that can vary from immediately after diagnosis to up to 20 years after diagnosis. So it would be really nice to know when that's going to happen. Finally, if we can identify changes in the immune system that are associated with disease progression, we may be able to develop new therapies that prevent that from happening and therefore prevent CLL progression. Thank you.